I would like to invite you to take the seats. Sorry for this very, very short break, and I hope you will enjoy our session. Thank you for being so passionate and still staying here. As we understand in this conference, patient advocacy is not the first thing that everyone wants to listen to, but that's why I congratulate you especially for staying here and waiting for our talks. So in this session, we will have 3 small presentations. One will be from me, one will be from Begonya, and one from Roi. And let's start. So probably I can get my slides. I have a short one, and as I understand, like in the beginning, we were promised that we will have 90 minutes, and we had prepared a very long, good session with the conversations and everything. But here we are with 30 minutes that we just lost to the previous session, and let's run through the slides. So I will tell you about the benefits of cooperating with patient organizations. So this is the detailed list of things that I'm doing. I'm a patient advocate for 20 years now, and of course nobody needs to know it, just the fact that I have a rare disease which is called the von Willebrand disease, and all my actions are related to bringing better world to people, and I'm not paid for this job. And what is a patient? We have in the laws, we have actually written down what is a patient. It is a person who receives healthcare services or seeks them. So basically every one of us at some point in our lives is a patient. But can anyone represent interests of the patient? That is the question that I have no answer to, and I hope that I won't have like my sarcasm again to answer it today, and I will leave this for you to understand. So what is a patient organization? We are patient organizations, like civic society organizations that are non-profit organizations, and we represent people with particular diseases or similar diseases, like a disease group, and we are governed and led by patients. That is the most important thing that distinguishes patient organizations from any other non-profit organization. That is for patients, by patients, and about patients. And what is not a patient organization? So probably some of you can find your institution on this list. And every time when you talk about representing patient interests, you have to talk to the people who are actually representing patient organizations. We are not very fond of those people who are patients but are not connected to the civic organizations, because in patient organizations we have huge amount of information. So who are we? We are like true patient organizations. With these I mean like the small community organizations that we have around the world, like patient groups, national, regional, sometimes they are only in the city, or some other amount of patients, but that's like a single disease or a single disease group and a single country or any like smaller thing. Then we have national umbrella organizations which can cover many diseases or single country, and we have also national patient organization platforms. The umbrella organizations would be something like we have cancer organizations. In Latvia, we have Onco Alliance, and we also have National Alliance of Rare Diseases. These are umbrella organizations for one country. And we also have patient platforms, which is like a Latvian network of patient organizations, which I represent here today. And that means that there are different kinds of organizations within one country that are working together. We also have patient federations, which are specific disease organizations that have wider nationalities. Like I have European Patient Forum will be under the next one, international platform. But federation is like hemophilia organizations in Europe, in South America, and places like that. International umbrella organizations would include organizations like Unheard and other patient organizations that are in one field but are working on a specific issue. And international platforms like European Patient Forum, which has different national platforms and national umbrella organizations and patient federations under their roof. So we have very many different ways how we collaborate and work, and the work we do is most of, like this is a survey we carried out many years ago, and we raise awareness about disease and health. And then we do a lot of advocacy. We educate the population, we educate the people that we are working together, and of course solving various issues that are related to patients when they call for support. So how Latvian network of patient organizations is organized? We have 11 member organizations. We work together with another 20 patient organizations in our country. There are 20 organizations that do not want to be part of our network, but we still try to send information out for them so they can be engaged in various decision-making things. And then there are different non-profit sector organizations, even professional associations that doctors are having. There are also NGOs in our sector. So our goal is to improve the quality of life and access to healthcare and services, and no matter what the diagnosis for the patient or any other thing. So that's why we are so connected with whatever happens in the country. So how you can benefit of working with us? It is the support and advocacy. This is a two-way street. When we can help you, you also can help us in things that we are doing. Education and awareness. There are so many projects that we can do together, we as patient organizations and you as professionals in what you do. Then surveys and research. This is Precision Medicine Forum. We will just in a minute hear a presentation in which we will understand how to involve patients in the clinical trials. And that's also something that we as patient organizations can help you. We can reach the patients and we can help you with the translations to understand if they are working in the population or not. We can disseminate information and of course patient stories. We will have a patient story today as well. That's why I'm running so quickly, so I can have time that I promised to my friends for the next talks. And if you have any questions, I'm always here. You can always find me online and just let me know what you need. So. I tried my best to do it very quickly, so now I invite Begonya to the stage to tell about herself and her presentation. Thank you.
Thank you. Thank you so much. It's my pleasure to be this afternoon with all of you. My name is Begonya Nafria. I'm working at Sant Joan de Déu Children's Hospital. This is the largest pediatric hospital that we have in Spain, and my role is coordinating a department that is fully devoted to incorporate patients and families in research and in innovation. And specifically, the topic of my presentation today, it's about a lobby and a research initiative that we are coordinating at this moment at the European level, that it's focused in the language discrimination in terms to access cross-border clinical trials. But first of all, let me introduce a little bit our hospital. As I said, we are a monographic, a pediatric children and maternity hospital. We cover all the pediatric specialties, and we have a very large clinical trials unit. We are at this moment managing more than 300 clinical trials. And in the last years, these studies are more complex. Not all the countries are involved. The average of countries at the European level involved in clinical trials, not for pediatrics. In general, usually it's around 3 countries. It means that the probability that a clinical trial of the disease of your child perform in your country, it's really low. And also these conditions basically are rare diseases. It means that also we have few patients in one country, and the only way sometimes to execute these clinical trials is incorporating patients from abroad, what it's considered the cross-border clinical trials, but we don't have any regulation in these regards. Said this, when you work in a very high specialized hospital, the reality of our daily life in research and also in healthcare is that we receive patients and families from abroad. And this is a general picture about our hospital. We receive, as you can see, patients and families from different countries. The ones that they come, of course, from South America, it's so easy to manage because they speak Spanish. But the other ones that they are not from South America, we need to facilitate, and accommodate translation to be sure that the healthcare and research is according to the language of these patients. But what we have seen in the last years is that not always in these clinical trials, this accommodation of language translation is included, and also in some cases it's a criteria to include or exclude the patients. But I will explain in more detail afterwards this research initiative. I want to showcase 3 different scenarios in which we work in pediatrics. We have cases like the story of Daniel. This is a child that he has low syndrome. This is a very, very ultra rare disease. We don't have any treatment for this condition. And as you know, in rare diseases, around 90% of the diseases don't have a targeted treatment. For the reason it's so important to have clinical trials. If we go to the clinicaltrials.gov and we search about the low syndrome, we cannot find any study. Another story is the story of Paul. In this case, we have something that is named drug repurposing. It's a treatment that was approved in the past that now we discover that can be useful for these children, and specifically for CDG, congenital disorders of the glycosylation. We did a clinical trial in our hospital, and now this treatment is accessible for the children with this condition. And the third case scenario that we have, that it's the best, let's say, of these 3, it's the story of Nora. Nora, she has spinal muscular atrophy. Many years ago, also, we didn't have any trial for this condition, but nowadays we have some trials, more than one. And also that we need to have in mind is that these trials sometimes are long. Nora, she started in the trial when she was a pre-teenager. Now she is a young adult and still is involved in this study that it's running for 5 years. It means that we need to have always in mind the needs and the perspective of our patients and our families, that they change, of course, along the years. And this is, as I said, the best case scenario, because if we go to the clinicaltrials.gov, we can see that for this condition, we have several countries with this condition in clinical trials, and in the case of Europe are 7 countries managing these clinical trials for this disease. As I mentioned, basically when we work with pediatric diseases, 90% of them, they don't have treatment, 80% of them are genetic conditions, and gene therapy can be a promising opportunity for children. But of course, these trials are complex, and we don't have opportunities for all these genetic conditions. And this is the data that I anticipated before. In general, when the trial is the sponsor, a commercial company, a pharma company, 3 European countries are involved. But when it's an academic study managed by a research institution or a hospital, usually it's 1, the country where the site is. It means that it's challenging sometimes, as I said, to find a clinical trial in the country where the patient and the family they live. And also what we need to have in mind is the challenge that we have in Europe, that we have many languages, and not everybody is bilingual or competent in English. This is a reality. If we go to Spain, my country, this is a reality. Some young parents, they speak English, and probably they can go abroad, but not everybody. And we have at this moment 20 different official languages in Europe, 24 inside of the European Commission countries. And this is the challenge that we want to solve with this project, because we have seen that some patients are discriminated according to the language that they spoke. There is, as I said, no regulation in regards of the cross-border clinical trials in Europe. There is a regulation for cross-border in healthcare, but we consider that it's unethical, and it's not aligned with the children's rights and the European patient rights that said that you cannot discriminate anybody for the language that you speak. Even we don't have a specific regulation for cross-border clinical trials, we have other legal frameworks that can apply and can help us to facilitate the inclusion of children from other countries in clinical studies. The challenge is there, of course, are solutions to solve the inclusion of these patients, and this is what we want to do with the research, see how we can accommodate the translation, not only for the communication between the doctor and the patients, also for anything in regards to the legal documents of the clinical trials, the informed consent form and the patient information sheet, but also, of course, in another area that it's so challenging, that are all the tools that we have in clinical studies to collect information from patients, the patient-reported outcomes, quality of life scales, etc., because not always are validated in the language of the patients. And only mention that this issue about language discrimination, it's not only happening in Europe, it's happening globally. This is an example of a clinical study managed by the National Institutes of Health in the US that you can read in the slide, that one of the exclusion criteria is that if the patient is not fluent in English, cannot participate. In the US, more than 50 million of people, they are not competent in English. Also, it's an internal problem that we have with some communities in some countries. This is the team that is helping me to move forward with this project. We are lucky because we have the support of EMPRIMA. EMPRIMA is the European Networks of Pediatric Research of the European Medicines Agency. And there we created a group of experts to support all the data collection and all the different stages of this research initiative. It's a complex slide, but I'm going to summarize the different phases of the research. The first one, it's focused in data collection. We are doing an analysis of the clinical trials protocols that are published in the clinicaltrials.gov database from 2017 until 2022. Basically to identify these studies in which I mentioned that the language is an inclusion or an exclusion criteria, because it means that an ethics committee approved in the past this study, it was performed, but some patients were not eligible according to the criteria of these studies. But also we are working, I don't know if I can, with other two sources of information. One is a collection of 3 questionnaires for children's hospitals and research institutions managing clinical trials to collect information about the experience that they have managing cross-border clinical trials. And the other source of information is a questionnaire addressed to parents. This questionnaire at that moment is accessible in 7 European languages. Hopefully soon, in a few days, it's going to be accessible also in Latvian. And in the upcoming weeks, we will have all the 24 languages accessible in this questionnaire, because also we need to make accessible the tool to collect the data. The phase number 2 of this project, of course, it's the data analysis. We want to analyze deeply the data collected, the patient-reported outcomes used, the eligibility criteria, etc. And the final phase is to deliver consensus guidance that will be at the end of a public consultation process accessible for sponsors and academic institutions to explain how you can manage and how you can be feasible the inclusion of patients coming from abroad in clinical trials in the European environment. And before to finish, I want to comment that even the number of patients that at that moment we have identified with these questionnaires that they have not been part of a clinical trial, it's small. For us, any patient that can be excluded of a clinical trial sometimes means, as a professionals working in a pediatric hospital, a very sad situation, because in these cases, there is nothing. We don't have an approved treatment, and the only thing that we say as an answer to the parents that are asking to us to be part in a clinical trial is, no, go home and wait there to see how the disease is evolving. And for us, this is unethical. And as I said, even if it's at that moment a small number, we want to identify these cases, and we want to facilitate in the future that any patient and any family interested to be involved in science can do it with no exclusion of their language. Thank you so much.
Begonya very much. And now we will proceed with the patient story from Roy. I think he knows how to introduce himself, so I don't have to. And please wait until end, then I will tell you something very important.
My book there. Camera people, where are my limits? Where do you guys see me? Because I don't want to. You see? Do you see me? See me? You hear me? Because if the camera don't see you, what do you do it for? Hey guys, my name is Roy. I come from Israel, and these are very tough times for us. I'm supposed to be all for talking about patients right now, but my heart is completely broken and devastated from what I'm seeing. So if you don't mind, I want to take like 10 seconds of silence to really think about what happened, because we lost 1,300 people, and the entire country is just in shambles. So I'm just going to. Thank you so much. We say in English that it hits close to home, because what happened to me personally is exactly what's happening right now. I was a soldier too. I was a medic in a field hospital, exactly there in one of those bases that got overrun by terrorists. We were there to save lives, and during my service as a medic, in a matter of 1 month, I was exposed to 12 different terrorist attacks, acts of atrocities, just like we're seeing today, but on a much smaller scale. And I've developed a traumatic reaction that led to an autoimmune response. And back then, mental health was such a taboo that nobody could say, I think I have a mental issue or an emotional issue, because you're a strong, young soldier, you're a macho. And I never went to see any psychologist. I would never offer a psychologist or any other health professional. And I ended up lying 7 years in bed without diagnosis, without treatment, and my life was just being drained out of me. Those 7 years in bed was a total nightmare. It was not a restful time in bed. I was so sick that even if I would try to change position in the bed, like in the pillow like this, I would faint. And I weighed 48 kilograms or 47 kilograms, which is 30 kilograms less than now. And I just could not do anything by myself, could not shower, could not go to the bathroom, could not do anything. And I've seen 33 doctors, and all told me the same thing. It's all in your head. You have nothing. We don't know what to do for you. We call it gaslighting today. Back then, we didn't have this term in medicine, and we didn't talk about paternalism in medicine. But I was forced to start my own personalized medicine journey, not with a genomic sense, but from a health navigation and adaptation of care sense. So after the doctor number 33 told me that I will never walk again, never talk again, never marry a man or a woman, never go to university again, I've decided that I have only two choices: whether I'm healing myself somehow or whether I'm killing myself. And to be honest, the second option was really on the table. I was ready to do it, but luck or serendipity, or don't know why, in that darkest night of my life, I've decided to read a book. I was not strong enough to commit this act, so I decided to read a book. And the book that I had next to my bed in the last few weeks before that was a book by a Jewish guy called Dr. Viktor Frankl. And this book is called The Man's Search for Meaning. And if you haven't read it, this is a must read, because After reading this book throughout this night, I realized that I'm not going to do anything to self-harm. I'm going to take responsibility and define my own patient journey. And what I did was to not only personalize my care, I had to personalize my diagnosis. I started to study medicine from my bed, literally taking the medical school of Tel Aviv curricula and materials and study for 2 years all the medical lessons I could, diagnosed myself, self-rehabilitate myself, teaching myself to walk and talk at the age of 27. And today I'm trying to be a champion for people like me that have invisible illnesses, mental illnesses, and that don't have a voice in healthcare. And I think the mistake that we're making in healthcare starts early on in the training of physicians, that we don't teach them empathy. My master thesis was trying to see what happens if you teach doctors empathy. And the results were amazing. First of all, I had to redo the entire survey because I thought I have a methodological problem, because half of my students were so low on the empathy scale, they were almost sociopaths. It sounds funny, right? And then we checked it again, and apparently in the specific medical school I did my study on, they just don't screen for any personal traits, just high school grades. And then there is nothing about patient centricity, empathy, resilience, nothing in the curriculum. So I took a micro-learning approach and taught a 3-hour worth of seminar to those doctors to be, and the results were astonishing. You can actually see improvement in their empathy scale. And I think that together with improving the working environment, providing mental well-being, and different training and career path, that this is a big deal. Yeah, I cannot do everything by myself. Maybe if we take care of the carers, we patients have better care. Another thing that I believe that we should do is to put patients in areas of power. I really believe that patients should be decision makers in healthcare. Firstly, for their own health journey and the decision around it, and secondly, to sit in those boards of HMOs and hospitals and ministries, not to be pet patients who sometimes come to a conference and speaking at the end, but really to be at the center of stage. And I think that we have amazing thing to learn from those e-patients, those empowered patients who took matter to their own hands, and some people like Baiba that are advocating for others, creating facilities, community lobbies, and so on. And some people are more influencers, but in any case, those patients are not only shaping their own individualized, personalized medicine, they help to share others, because eventually, even when we're talking much higher on the macro than genomics, every patient has its own unique story. And when we're talking about patient data or patient experience data, proms and prems and all this, what's really important is the story. First of all, to not miss diagnosis like this, because 70% of diagnosis, it's in the initial conversation, and it's being missed because of really bad IT, lack of time, paternalism, gaslighting, very bad communication between both sides, without blaming anybody. And second of all, every unique story of patients can not only shape their own life, but be influencing on other people's life. So I'm calling you here, no matter where you work and what you do, to rethink how patient can play a role in healthcare and help empower them using patient education, which is completely missing from our institutions, patient empowerment, and using the patient voice to rebuild resilience and empathy also in the people who take care of them. Thank you very much. Thank you.
Thank you, Roy. I know we are a little bit over time, but since we were stolen 10 minutes in from the previous session, I will just use the chance of being the moderator, and I would encourage to have at least one question, if you have some burning question. There is one.
I did exactly 10 minutes, so.
I know, thank you.
Thank you. It's not even a question, it's a comment when Roy, you were saying about empowering patient. For last 2 years, I live in Poland now, and I was very surprised of their healthcare system. So whenever you book an appointment with a doctor, everyone, all patients, would go to the platform, which is called a known doctor, where all doctors, they have stars, and the stars are for empathy. And I actually feel like we have a voice, and you would always want to go first to the doctor with the 5 stars. And okay, then there is someone with the 3 stars, but then you look at the reviews, and in 2018, 19, there was very low empathy. So the doctor was just recent graduate, but I think they take it on board, and as during their career, they develop this empathy because they see this is what patients value. So I think this is a very small thing that can be implemented everywhere, but everyone benefits, and patients and doctors. And I think you were so much to the point about the empathy that I only saw the value now when I heard your talk. Thank you so much for sharing.
Thank you so much. It's a wonderful point about social nudging. I never thought about it like this. Thank you so much.
Thank you. I also think that empathy is one of the most important things, because behind every number that you see on the graph everywhere, there's a real person behind. And what we need is you to understand what difficulties we go through with our diseases, and help us put it in numbers so you can read them from the tracks that are in other sessions, which they call scientific sessions, in which we are kind of not allowed in. Okay, but enough of complaining. I promised you to give you a treat. So I was told that there is wine upstairs. So for being so patient and even running over the time, I invite you for the final networking session upstairs with the glass of wine, and hopefully see you next year again. And I really hope that we will have a patient in every session that there is, and that the patient session won't be moved from the day till the very evening. And thank you, my panelists, for coming over, and I hope that you will make lots of connections here.
And I will just show you, I never do stuff like this, but just because we filmed it before. I wrote a book that is called What Do Patients Want? So it's all over Amazon and everything. If you want to learn what us, this strange animal called a patient, wants and feels, you can search it. Thank you so much. Thank you.